esophageal cancer a year.
Wow.
It's the number 5 killer. It's the 8th biggest killer in the world. So it's something to really worry about. But the 5-year survival has gone from 5% in 1990. So in your lifetime, right?
Yeah.
What year were you born?
87.
Okay, so in your lifetime, it's gone from 5% to 19%. So it's 400% what it was when you were born.
Why is that? Is that because of a detection, earlier screening?
I don't know if it's that. It's probably better chemotherapy and better radiation. I mean, now, for example, we do radiosurgery for the esophageal cancer, so we're able to focus on just the cancer and avoid harm to the healthy tissues.
Yeah.
Maybe imaging is better. There weren't commonly PET scans done 20 years ago, so we can better see where the cancer is and attack it.
Right.
15% of people with esophageal cancer have occult cancer. So if you get a CAT scan and a physical exam, you make the stage.
Yeah.
But if you add in a PET scan, actually 15% of people will have cancer seen where it wasn't suspected.
Okay.
So PET scans and imaging are also helping us know exactly the stage. And some of the older data probably had occult disease, meaning unknown distant metastasis present but was not able to be detected.
Sure.
So stage 1, T1, which is in the mucosa only, can be resected. The other stages are treated with chemoradiation or radiation and pretty good palliation. For squamous cancer, the 5-year survival right now is 59%, and local control is 80%. Local control means where you aim the treatment, you can stop the cancer. So most people believe if you have a better local control, then you're going to have a better chance of curing it. Because if you don't control the local disease where it started, probably you're never going to have good success.
That makes sense.
And most doctors actually at the meetings said that radiation is superior than surgery for stage 1, and for stage 2, 3, 4, radiation was the preferred method of treatment, along with chemotherapy for certain patients. So that's kind of an update for esophageal cancer, which is one of the big killers, unfortunately, and we're making progress.
Yeah.
So I think if you have symptoms, come to the doctor early. Please come to the doctor early. Do you know the risk factors for gastric cancer?
For gastric cancer?
Yeah.
Alcohol is one.
What do they teach you in medical school?
I think alcohol, smoking, weight, being obese, right? Not having enough fiber, I believe.
Okay, well, went to the update, and it was very interesting. There's 21,000 cases a year in America. So similar to esophageal cancer, 11,000 deaths. So it's 50% live, 50% die. And males have more than females. You know, one of the top causes is no refrigeration.
Really?
Uh-huh.
Wow. I had
Societies
no idea.
where there's lack of refrigeration, or families, because there exists in the world places where there's not refrigeration. We take it for granted. Every house has a plasma screen TV and a phone and air conditioning and a refrigerator a washer and a dryer and a disposal and a stove, right?
We do take it for granted.
And most houses in America have it. But actually, lack of refrigeration is one of the big risk factors. Even in the United States, the incidence of gastric cancer has fallen as refrigeration is becoming widespread in the United States.
Oh, wow. That's
so
good.
It wasn't always widespread. I know in your grandfather's age, you can ask them, they probably did not have refrigeration. Maybe they had a box with some ice.
Sure.
Right? And the Iceman came and they, right?
Yeah.
So it's a recent phenomenon. Worldwide, gastric cancer is the number 2 cause of cancer deaths.
Yeah.
So it's really, really common. And that has to do with the fact that gastric cancer is very common in Asia, Japan, Korea, China. It's much more common. It's more common with smoked meats and salted meats.
Right.
So a lot of societies have that. Also, low-fat diet. I mean, here we are preaching a low-fat diet, right?
Yeah.
Isn't everyone told to get a low-fat diet?
That's
and yet low-fat diet is one of the risk factors for gastric cancer.
Wow.
And if you think about that, if you've been to Japan, for example, a couple of years ago, I went and gave lectures in Japan, and they took me out for these meals. And after the meals, I was just so hungry. I used to go to 7-Eleven and get potato chips because there was such low fat content in their diet.
Yeah.
And you can kind of get a sense of why it's big killer in Korea and Japan. H. pylori, which is an infection. So many people have H. pylori, and that's a risk factor. H. pylori causes the stomach acid to diminish. It causes atrophy, which is meaning there's less function of the mucosa. Mucosa in the stomach is supposed to make all these juices, right? And these juices help with digestion. And H. pylori infection causes a dry out of those juices.
Right.
And so that the environment of the stomach is less acidic. That's another cause.
And I think H. pylori also leads to ulcers, too.
That's right.
Yeah.
That's right. It's commonly seen in people who have gastric upset and are ulcers, and they get a biopsy and they find H. pylori, which is actually one of the big discoveries in the last 20 years. When I was in medical school, there was no H. pylori that we knew about.
Yeah, that's right.
And now everyone talks about it. All the patients talk about it. I had H. pylori. I got antibiotics.
Yeah.
That discovery may well have saved their life.
Yeah.
So people don't talk about it. Another reason why the incidence is falling of gastric cancer because of H. pylori. So there's a lot of benefit from chemoradiation. Actually, there's meta-analysis that's showing people with gastric cancer who have chemoradiation and surgery have a much higher chance of being cancer-free.
Okay.
So we're treating quite a few patients. We just treated a man who had an unresectable gastric cancer. The cancer was growing through the wall into the adjacent tissues. He had PET scan positive there only. We gave him chemoradiation. We used radiosurgery so he could focus in on that area only and avoid the healthy stomach so he wouldn't have the side effects. He had the treatment. We repeated the PET scan, and the cancer went away.
That's excellent.
Yeah, so we had a good result, and it was really very, 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 very rewarding to be able to tell him that. Do you know overall the cancer mortality in America has fallen by 20% in the last 20 years?
Wow, I did not know that.
Yeah.
Yeah.
So things are happening. I mean, maybe I don't know if you feel them or not, because people always have a particular view, but take all the mortality of cancer in America, it's fallen by 20% in 20 years.
Wow.
So it is interesting.
And I suppose that's because of the technological advancements in treatment, and also because of the earlier screening.
The early screening, better staging. One of the things one of the speakers talked about is that we need evidence-based treatment, not faith-based treatment. So when you go on and talk about, I'm going to take vitamins and minerals and antioxidants, actually it doesn't work.
Yeah.
Dr. Ofit is coming on tonight. We have a special program tonight. So he's going to talk about why taking vitamins and antioxidants gives you a 25% higher chance of dying. So when you hear about buying all these vitamins and antioxidants, again, it seems to be a business thing, not a medical thing. And when you actually look at the studies, which we'll discuss tonight at length with Dr. Ofit, who wrote this great book, Do You Believe in Magic? You'll learn why vitamins and antioxidants increase your chance of dying. So before you take your multivitamin today, if it got you before you took it, you might not want to take it. We have Dr. Eisen on the phone. Dr. Eisen is a Argentinian-born, Spanish-speaking and English-speaking radiation oncologist trained at Columbia, and his specialty is taking care of cancer patients in the Spanish community. So good morning, Dr. Eisen.
Good morning, Dr. Lederman.
Did I say that all right, that your specialty is taking care of the patient Spanish-speaking and English also, and you were born and raised and educated in Argentina and then had radiation training at Columbia?
Yeah, that's right. I do enjoy working with the Spanish community. And once again, I would like to say that that's what makes the difference many times, because the patients are able to speak their own language and go over the records in a very, very easy pace. And many times that's what makes the difference between other places and our center.
Well, we know we're the best. Tell me something. You had several interesting cases this week. One you had, I know about a woman with an advanced sarcoma, and she went all over the major medical centers and was given chemo and all kinds of things which did not work. And you treated her with radiosurgery. It was a massive sarcoma with metastasis, and you were able to stop the massive sarcoma and actually the metastasis stop and shrink them down. So with non-invasive treatment, you had very good success in treating her sarcoma wherever you aimed the beam. Isn't that correct?
That's right. And also, when she came to us, our good thing was because they couldn't control her pain as well. And now, between her medications and our treatments, she's able to do a little bit better. Actually, lately I saw her and she's improving in some areas. She can use less pain medication. And, most of the doctors outside, they were almost giving the situation and tell her, we cannot help you. And
well, she was going to go on hospice, right? They were pushing her to go on hospice, and she didn't want to go on hospice. And in fact, you treated several areas, and they were all better. The PET scan shows improvement where you treated. So congratulations. And I know you had another woman, and we like to talk about that, is recently this week you saw a woman who had a breast mass, and she was kind of shy or ashamed or embarrassed to come to her doctor. She had it for quite a while. And she came to you because of this program. She heard about the program and the fact you could be diagnosed pretty easily. Just put a needle in the lump, which is painless. She was diagnosed. She had a PET scan. We know exactly where the cancer is. And the cancer was confined, right?
That's right.
And most likely you're going to cure her, and she's going to keep her breast. So she's going to keep her breast and most likely keep her life. And thanks to you and thanks to this program and thanks to her intelligence for believing in you.
And the other thing that was fascinating in this patient was that one of the reasons why she decided to wait with her lump on the breast was because originally when they were trying to do the biopsy, she had a bad experience and she got so scared that she decided to wait almost 2 years. And then after listening to the program, she was a little bit afraid when she came in. All of a sudden, she started feeling comfortable, and in less than a week and a half, we were able to make the diagnosis, the x-rays, the referrals to the surgeon who did the lumpectomy. And I just saw her last week, actually, with you, and she's extremely happy. She has a very, very good experience with our group and our team. And that's another incredible story, a patient that was just very scared, waiting at home, feeling her lump, and not doing anything.
Right. So how do people find you if they want to speak to you directly in Spanish or English?
They can call me at 917-836-8105.
Can you tell us again in English, please?
In English, it's 917-836-8105.
And what about in Espanol?
In Espanol is 917-836-8105.
Encore.
917-836-8105.
Okay, gracias, doctor.
Okay, buenos días.
Bye, ciao.
Bye-bye.
We're going to hear from our sponsor, and then we'll be back with some more cancer news. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices.